Why do cystic fibrosis patients get so many respiratory infections? Imagine your lungs as a busy city with tiny roads and cleanup crews working nonstop to keep everything clear. In cystic fibrosis, that city faces a big problem because the cleanup crews can't do their job properly. This is mainly because of a gene called the CFTR gene. When it doesn't work right, it causes the lungs to produce thick, sticky mucus instead of thin, watery mucus. This sticky mucus is like a thick glue that sticks to the walls of the airways and makes it hard to clear out. Normally, the CFTR gene helps control the movement of chloride and bicarbonate ions across cells in the lungs. This movement keeps the mucus thin and hydrated, so it can trap germs and debris and then be cleared out easily. But in cystic fibrosis, mutations in this gene cause the transport of these ions to be faulty. As a result, the mucus becomes dehydrated and much thicker than normal. This thick mucus acts like a trap for bacteria and other microbes that we breathe in every day. Because the mucus is so thick and sticky, the normal cleaning process in the lungs, called mucociliary clearance, doesn't work well. This process usually moves mucus and trapped germs out of the lungs. But in cystic fibrosis, the mucus clumps and traps bacteria instead of removing them. These bacteria can then multiply and cause infections that keep coming back. The most common bacteria involved are Pseudomonas aeruginosa and Staphylococcus aureus, which are tough to get rid of once they settle in. When bacteria stay in the lungs, they cause ongoing inflammation. This inflammation damages lung tissue and makes the mucus even thicker and harder to clear. It's a vicious cycle. Thick mucus traps bacteria, bacteria cause infection and inflammation leads to more mucus production and airway blockage. Over time, this cycle can cause serious lung damage and make breathing more difficult. That's why lung infections are a leading cause of health problems and even death in people with cystic fibrosis. People with cystic fibrosis often have symptoms like a persistent cough, thick phlegm, sinus infections, and nasal polyps. Managing these infections and helping the lungs clear mucus are key parts of treatment. Doctors often recommend therapies to thin the mucus, improve airway clearance, and fight infections with antibiotics. These treatments aim to slow down lung damage, improve breathing, and help people with cystic fibrosis live longer and healthier lives. Understanding why infections happen so often in cystic fibrosis helps us see why ongoing care is so important. It's not just about fighting bacteria but also about supporting the lungs' natural ability to stay clear. Every person's experience can be different, so it's essential to work closely with healthcare providers to find the best treatment plan. For anyone living with cystic fibrosis, regular checkups and personalized care are vital to managing this complex condition and maintaining quality of life.